Welcome to Biosafety Principles Training, presented by Bonneville Labs. The purpose of this Biosafety Principles training is to provide a high-quality and safe environment to conduct BSL-1 and BSL-2 level research, provide effective procedures that protect employees from exposure to infectious agents, prevent environmental contamination, and define and implement procedures required to comply with applicable federal, state, and local regulatory requirements and biosafety in microbiological and biomedical laboratories, BMBL, for performing BSL-1 and BSL-2 level activities. There are several objectives of the Biosafety Principles training, including regulatory overview, ways to protect yourself, biosafety levels and risk groups, transporting biological materials, biological waste and disinfection and decontamination. The Biosafety Manual is a valuable resource tool for laboratory workers, providing information, guidelines, policies, and procedures to promote safe work practices and reduce the potential for exposure to biological hazards. It covers a wide range of topics, including safe handling of materials, lab procedures, and emergency measures. Additionally, the resource includes the Biosafety in Microbiological and Biomedical Laboratories Advisory Document, which offers best practices for conducting safe work in biomedical and clinical labs from a biosafety perspective. By using the guidelines in the manual, lab workers can confidently and safely conduct their work. Biosafety is the set of principles and practices used to protect laboratory personnel, the public and environment from exposure to or lab-acquired infections, LAI, while working with potentially infectious materials such as bacteria, viruses, fungi, human blood, unfixed tissue, human cell lines, and recombinant DNA. It includes the implementation of guidelines, policies, and procedures that help to prevent the accidental release of these materials and to minimize the potential for exposure. The role of a safety officer is to coordinate and monitor the safe operations within a laboratory or work environment. They are responsible for ensuring that new processes, chemicals, and biological materials are approved and safe to use. They also play a key role in maintaining compliance with company EHS, environmental, health and safety, programs, policies, and procedures. Safety officers make sure that all employees have completed the necessary training, and they provide training and information on emergency and lab procedures. This includes educating employees on safety protocols, emergency procedures, and hazardous materials handling. They also may conduct regular safety inspections and audits to ensure that safety protocols are being followed correctly and to identify and correct any deficiencies. The role and responsibilities of employees in a laboratory or work environment include following company rules, policies, and procedures, and actively participating in maintaining a safe working environment. They have the obligation to report any accidents, unsafe conditions, or unsafe acts to the safety officer as soon as possible. They should familiarize themselves with emergency procedures, the location of safety equipment, and know the correct procedures to use them. They also should maintain good hygiene and housekeeping practices to minimize the risks. It is essential that employees complete all assigned and relevant trainings, as this can help them understand the hazards associated with the work they are doing and the measures they can take to minimize the risks. Advanced approval is required before using any new pathogen or chemical in the laboratory. The process for obtaining approval includes the following steps. Contact your safety officer, who will guide you through the approval process and provide you with any necessary forms or documents. Complete a risk assessment. This will evaluate the potential hazards associated with the use of the new pathogen or chemical, and identify any necessary precautions to minimize the risks. A risk assessment approach is a process that helps to ensure biosafety by identifying and assessing the potential hazards associated with working with pathogens or other biological materials. The 6-step risk assessment approach includes the following steps. Identifying the pathogen's hazardous characteristics, including the agent, procedures, and worker. Identifying laboratory hazards, including the type of manipulation, probability of exposure, and equipment hazards. Assigning the appropriate biosafety level, BSL, containment and determining the necessary controls. Applying the hierarchy of controls, including engineering controls, administrative controls, and personal protective equipment, PPE. Providing training and implementing the necessary controls. Determining the effectiveness of the controls through inspections and making improvements as necessary. Routes of exposure are the ways in which a person can come into contact with a hazardous biological agent and become infected. Occupational infections, laboratory-acquired infections, LAIs, and poisonings typically occur through one of the following routes. Inhalation of infectious aerosols. Ingestion of liquid suspension of an infectious agent or by contaminated hand-to-mouth exposure. Absorption through direct skin, eye, or mucous membrane exposure to an agent. Inoculation by a syringe or contaminated sharp cuts, punctures, or non-intact skin contact. Facility design and construction play a critical role in ensuring the safety of laboratory personnel. The primary objective of laboratory design should be to provide a safe, accessible environment for laboratory personnel to conduct their work. To achieve this, the laboratory should include the following features. Controlled access zones to support the separation of the laboratory from office and public areas. Emergency eyewash and shower stations. Adequate ventilation systems. Sinks for hand washing. Negative pressure rooms for specific types of work. Airlocks and anterooms for added protection. Separate areas for different levels of containment, e.g. Biosafety Level 2, Biosafety Level 3. Safety equipment, administrative controls, and work practice controls are critical elements to ensure the safety of laboratory personnel. Administrative controls, such as standard operating procedures, must be implemented and followed by all personnel working in the laboratory. These procedures help to minimize the risks of exposure or accidental release of hazardous materials. Additionally, work practice controls must be established and followed to reduce the risk of exposure to biological hazards. It is important that all laboratory personnel understand and follow the safety equipment, administrative and work practice controls to minimize risks and ensure a safe working environment. Risk groups and biosafety levels are used to assess and manage the risks associated with working with biological agents. Risk groups classify the agents based on potential harm to humans or the environment, while biosafety levels determine the level of containment needed to safely handle the agent. In most situations, the biosafety level aligns with the risk group of the agent, with higher risk agents requiring a higher level of containment. Risk Group 1, RG1, agents are biological agents that are considered to have a low potential to cause harm to humans or the environment. These agents have a low virulence, a low degree of pathogenicity, and have low infectivity. RG1 agents usually cause minimal human disease and are unlikely to cause a serious outbreak. These agents can be handled using good laboratory practices and standard microbiological practices. RG1 agents are considered to be the least hazardous group of biological agents. Risk Group 2, RG2, agents are biological agents that have a moderate potential to cause harm to humans or the environment. These agents have moderate virulence and/or moderate pathogenicity and are typically associated with human or animal diseases that are rarely severe or life-threatening. RG2 agents can cause infection, but they do not generally spread easily from person to person, and the risk of spread is low. They should be handled using good laboratory practices, and additional biosafety precautions are necessary to prevent laboratory-acquired infections, LAIs. Risk Group 3, RG3, agents are biological agents that have a high potential to cause harm to humans or the environment, and are capable of causing serious or lethal human or animal diseases. These agents are associated with a high degree of virulence, pathogenicity, and infectivity, and may be transmitted easily from person to person or through the environment. RG3 agents require high levels of containment and strict adherence to biosafety procedures to prevent laboratory-acquired infections, LAIs, and environmental releases. Risk Group 4, RG4, agents are biological agents that have the highest potential to cause harm to humans or the environment. These agents are associated with a high degree of virulence, pathogenicity, and infectivity, and can cause severe and often lethal human or animal diseases. RG4 agents may be transmitted easily through the air, by direct or indirect contact, or by accidental laboratory exposure. These agents require the highest level of containment and strict adherence to biosafety procedures to prevent laboratory-acquired infections, LAIs, and environmental releases. Risk Group 3 and Risk Group 4 agents are not allowed on site. Biosafety levels, BSL, are used to determine the level of containment required to safely handle biological agents. The levels range from BSL-1 to BSL-4, with BSL-1 being the least restrictive and BSL-4 being the most restrictive. Each level of containment includes specific requirements for lab design, safety equipment, and work practices. BSL-1 is the standard laboratory practice level, which includes basic infection control measures, such as the use of personal protective equipment and good laboratory practices. BSL-2 includes additional measures to prevent the spread of infectious agents, such as the use of biological safety cabinets and additional training for laboratory workers. It is suitable for agents of moderate risk. BSL-3 adds even more stringent measures, including the use of positive pressure personnel suits and specialized ventilation systems, and is suitable for agents of high risk that may cause serious or lethal disease and for which treatments or vaccines are not readily available. BSL-4 adds the highest level of containment and is intended for agents that poses a severe threat to public health and safety, such as deadly and exotic agents for which vaccines or treatments are not available. Biological Safety Cabinets, BSC, are specialized laboratory equipment used to provide a safe and contained environment for handling biological agents. They are particularly important for BSL-2 and higher work, as they provide an extra layer of protection to prevent the release of hazardous agents into the laboratory environment. Class 2 biosafety cabinets are the most common type used in laboratory settings, and provide a physical barrier between the laboratory worker and the agents being handled. They also use HEPA-filtered air to protect the worker and the environment. BSCs may also be used for non-volatile toxic chemicals and minute amounts of volatile chemicals, such as isopropyl alcohol, IPA, acetone, and xylene, but it's important to keep in mind that the fans used in BSCs are not spark-proof and the use of certain chemicals could result in a fire or explosion. It's also important to note that using flammable chemicals like propane, butane, or anhydrous formaldehyde is not recommended. Door placards are an important part of laboratory safety, as they alert people to the hazards that may be present within the laboratory. These placards must be prominently displayed on the entrance of the laboratory and must contain the following information: the agents present in the laboratory, the specific hazards associated with the agents, the precautions required to be taken before entering the laboratory, such as the use of personal protective equipment, PPE, emergency contact information for assistance in case of an emergency. It is crucial for all laboratory personnel, as well as visitors, to take note of the information on the door placard before entering the laboratory. Reading the placard can help ensure that individuals are aware of the hazards present and the appropriate precautions to take. This includes knowing the emergency contact information, which can be crucial in case of an emergency. Hand-carrying biological materials between laboratories can pose a risk if not done properly. To ensure safety, it is important to use leak-resistant containers and ensure that they are properly labeled with a biohazard label. The label must include the following information: the identity of the contents, Ownership information. Any appropriate biohazard information. To prevent leakage and limit potential exposure, it's also important to place the primary container inside a secondary container. The secondary container should be made of durable, leak-proof material and be big enough to contain any potential spills or leaks from the primary container. When transporting biological materials out of a facility, it is important to follow the requirements set by the Department of Transportation, DOT, and International Air Transport Association, IATA. The safe transport of biological materials to domestic and international destinations are governed by these requirements, and specialized training is necessary to comply with them. DOT's dangerous goods shipping training is required for persons shipping hazardous substances every 3 years for ground transport, and every 2 years for IATA air. This training covers the proper handling, packaging, labeling, documentation, and emergency response procedures for hazardous materials, including biological materials. It is mandatory to have a trained individual in charge of the shipping process, who's familiar with the regulations and able to ensure that the package is compliant before releasing it. Solid biohazardous waste, also known as biowaste, must be properly handled and disposed of to ensure the safety of laboratory personnel and the environment. Proper disposal of biowaste includes placing it in a red biohazard bag that is marked with a biohazard symbol. The container for the biohazard bag must be leak-resistant and have tight-fitting covers. The container must be kept clean and in good repair. The container must be solid/rigid and able to maintain its shape and integrity. The container must be labeled with biohazardous waste or have the International Biohazard symbol and the word biohazard on the lid and sides so as to be visible from any lateral direction. Handling and disposing of sharps, such as needles, scalpels, and broken glass, is an important aspect of laboratory safety. To ensure the safety of laboratory personnel and the environment, sharps must be placed in a U.S. Food and Drug Administration, FDA, approved sharps container. The following guidelines must be followed when disposing sharps. The container must be closed or have a tight-fitting lid to prevent the loss of contents. The container should be stored for no more than 30 days before disposal. The container must be labeled with the words sharps waste or with the International Biohazard symbol and the word biohazard on it, so it's easily recognizable as sharps waste and should be treated as biohazard waste. Liquid biohazardous waste, such as laboratory cultures, must be properly treated before disposal to ensure the safety of laboratory personnel and the environment. The recommended method for treating liquid biohazardous waste is to mix it with a 10% bleach solution and let it sit for 25 minutes before disposing of it down a laboratory sink. This will inactivate any viable microorganisms and prevent the spread of infectious agents. The concentration of bleach should be between 1 to 10% by volume, with the recommended being 10%. It's important to note that liquid biohazardous waste containing hazardous chemicals should not be treated with bleach. They should be disposed of as chemical waste according to the regulations. The 3 C's of disinfection is a simple guide to keep in mind when selecting and using disinfectants. The 3 C's are compatibility. The disinfectant you choose must be compatible with the surfaces and materials you will be cleaning and disinfecting. It's important to verify the effectiveness of the product on the surfaces, especially if you are using it on surfaces that are sensitive to certain chemicals. Concentration. Disinfectants must be used at the correct concentration to be effective. Always follow the manufacturer's recommendations for dilution to ensure that the disinfectant is as effective as possible. Contact time. The disinfectant must be in contact with the surface for the recommended amount of time in order to be effective. It's important to read the label and follow the manufacturer's recommendations for exposure times to ensure that the disinfectant is able to inactivate any microorganisms on the surface. By following these 3 C's, laboratory personnel can help ensure that they are using the correct disinfectant for their application and that it is used in a safe and effective manner. Proper decontamination of laboratory equipment and work surfaces is an important aspect of laboratory safety, as it helps prevent the spread of infectious agents and protect laboratory personnel and the environment. Laboratory equipment and work surfaces should be decontaminated with an effective disinfectant on a routine basis to ensure that they are free of any contaminants. After work with infectious materials is finished. After spills, splashes, or other contamination by infectious materials. It is also important to decontaminate any equipment that is to be removed from the facility before it is sent for repair or maintenance, or packaged for transport. This process should be done in accordance with local, state, or federal regulations to ensure that equipment is safe for handling and transportation. In closing, to ensure a safe laboratory environment, it's important to follow these safe work practices. Understanding the hazards of the materials you work with through risk assessment. Using appropriate engineering controls to reduce or eliminate hazards. Following established safe work practices and standard operating procedures, SOPs. Regularly decontaminating, sterilizing, and disinfecting equipment and surfaces. Wearing the appropriate personal protective equipment, PPE. Knowing what to do in case of an emergency or accident. Proper hand hygiene and good lab practices. Familiarizing yourself with the materials you are working with and the available resources such as Safety Data Sheet, SDS. Minimizing droplets and aerosols production. Proper handling and transport of specimens and compliance with regulations. Mechanical pipetting and avoiding mouth pipetting. Planning your work in advance and being organized. Incident reporting is a crucial aspect of ensuring a safe working environment. It is important to immediately report any work-related injuries, illnesses, incidents, and/or near misses that occur as a result of employment to the safety officer and manager, including those that happen off-site or during company-related travel. The safety officer is responsible for notifying the operations team of the name of the employees affected and the nature of the injury. The manager and safety officer must also complete an incident report for any injuries, illnesses, incidents, and/or near misses related to job activity within 24 hours and submit it to the site manager and operations team. This report should include details of the incident, the cause of the incident, the action taken, and any preventive measures that have been put in place to prevent a recurrence. Incident reporting is important to identify potential hazards, analyze trends, and implement corrective actions to prevent future incidents from occurring. Thank you for taking this training. To complete the training and ensure you receive credit, please complete the quiz.